But the question is if I would continue pemetrexed as a single agent in maintenance setting along with pembrolizumab after completing double agent chemotherapy with pembrolizumab. And my answer is I would, because it has clearly been shown that works. We know the benefit of maintenance therapy in the setting of non-squamous non-small cell lung cancer with pemetrexed, and there's no reason for me to stop it. However, if patient gives me any hint of additional toxicities, then I would have no problem dropping one drug, and the one I would drop at that point would be pemetrexed, because we know that prolonged exposure to immunotherapy does happen in patients who are more likely to be long-term survivors. There was recent data from Hopkins group, Julie Bramer, that at 5-year mark, if you look at patients who have been treated with chemotherapy with stage 4 disease, you have 4% people surviving that long. And when you look at the immunotherapy treated patients, 16%, so it's quadruple. So I would continue pembrolizumab and stop pemetrexed if there's any toxicity concerns.